Question number 8 in the name of Deputy Thomas Broughan.
Thanks, Ken. Well, I'm aware, Minister, that the total funding, I think, on the Fair Deal scheme is almost €1 billion, and that there have been an increase earlier this year. And I just wanted to ask you in relation to that, how many of the promised 1,600 places have actually been delivered? And I think an earlier 300 also that you promised to deliver. And in general, how prepared are we for the forthcoming winter? Last November, I think we had 2,000 people waiting for a nursing home place. What preparations have been made to avoid this winter? Thanks, Ken.
The Nursing Home Support Scheme, the Fair Deal, is a system of financial support for those in need of long-term nursing home care. Participants contribute according to their means, while the state pays the balance of the costs. In 2015, the scheme was allocated €993 million. In the budget of 2015, additional funding of €25 million was provided to support services that provide alternatives to and relieve pressure on acute hospitals. Of this €25 million, €10 million was used to provide an additional 300 places under the Fair Deal. This reduced the waiting time for approved applicants from 17 weeks to 4 weeks now. €8 million was used to provide access to an additional 115 short-stay beds across the Dublin area. €5 million to provide 400 additional home care packages, which will benefit 600 people in the course of the year, and €2 million to expand community intervention teams in primary care across Dublin and the surrounding region. In April 2015, the Government provided a further €74 million to address issues that impact on delayed discharges. This amount was in addition to the €25 million provided earlier and was allocated as follows. €44 million was allocated to the Nursing Home Support Scheme to provide an additional 1,600 places to further reduce waiting times for approved applicants from 11 weeks to 4 weeks. The funding will allow the HSE to increase the rate of approvals during periods of increased demand, including any surge in winter months, so as to maintain the waiting time for approved applicants at no more than 4 weeks. Over the coming months, the number of people supported under the scheme will increase on an ongoing basis, and the scheme will be supporting in excess of 23,900 people by the end of 2015. The remaining €30 million was principally applied to provide additional transition beds, some of which are on a temporary basis to address particular pressures being experienced by acute hospitals. When the Nursing Home Support Scheme commenced, a commitment was made that it would be reviewed after 3 years. This review is considering the scheme's long-term viability, as well as looking at how well the current model of provision is balancing residential care with care in the community, and whether this needs to be adjusted to better reflect what older people want and need. The review of the scheme is almost complete and is expected to be published in the next shortly.
Thanks, Ken. Just about the review, first of all, are you aware of what there have been some reported recommendations, if you like, in the media? Are those accurate, or when do you expect to be able to publish the recommendations, and what might you be expecting? There seem to be indications that there would be additional financial requirements required from clients of the scheme. We just asked you in general terms. You spoke there, I think, a few weeks ago about unmet needs in the health service, and that up to €1 billion additional funding might be required this year. I asked on Taoiseach the other day about this. He seemed to indicate that there might be a supplementary budget at some stage before the end of this year for 2015. I just wondered, will that include the Fair Deal scheme? Will any of that funding go towards that? You're aware, obviously, of the work of Alone, the Home First campaign, which indicates, very clearly that many more seniors would do well at home if you, in actual fact, were able to put more money into home supports and the home care packages.
Thank you, Deputy.
And there's a large waiting list, as you're aware, for that as well.
Back in again.
Okay, thanks, Ken.
That's a number of questions there. The Fair Deal review is done. I expect to be published in the next few weeks. It doesn't so much make recommendations as give options of different things that could be done to make the scheme more sustainable in the years to come, and then makes recommendations about alternative ways, perhaps, of funding home care a bit better, and lots of other things like that. So it's quite an interesting report, and also addresses some of the unfairnesses that may exist, particularly for self-employed people and farmers in the way that they're assessed for the Fair Deal, and makes some recommendations there. On the sorry, I've forgotten quite a number of questions there. Look at it, it's absolutely our preference that people stay at home for as long as possible, and it is less expensive by and large to have home care packages than to have a fair deal places. And the proportion of people going to nursing homes actually is falling, even though the raw numbers are increasing. The percentage of people over 65 in nursing homes is actually falling, which is instructive of the fact that better home care is now available.
Care packages itself, Minister, the fact that there's still a very significant waiting list. Yeah, obviously, the waiting time for the fair deal itself is significantly down. You mentioned 4 or 5 weeks there, but in relation to the home care packages themselves, I mean, what do you intend to do about that? Did that form part of the amounts you were thinking of in terms of unmet needs?
Additional, like I say, additional 10 million was used to provide. And sorry, I can't remember. It was it was 5 million was provided this year to provide an additional 400 home care packages to the benefit of 600 people. The waiting time for it varies from region to region quite significantly, which is a real difficulty. Also, the HSE has been given flexibility to spend more on home care packages where they're running into trouble staffing units. So particularly if they can't open a community unit or can't get nursing staff to open a community unit, they can now divert that funding to additional home care packages, and that actually is being done.
Question